I'm Dan Drake. This is Front Up, and with us today is Tess Pearson, the Executive Director of Family and Children's Services of Nantucket. Tess, welcome.
Thank you. Thank you for having me.
Before we get into talking about Family and Children's Services, let's hear a little bit about you and where you're from and your background and so forth, because you're new to the organization.
My husband and I moved from Chapel Hill, North Carolina about 3 years ago. We washed ashore, and we came up here for his work. I've been with Family and Children's Services for the last 3 years in a capacity as an outpatient therapist. My background was I was previously working for the VA administration, and
in Chapel Hill?
In Chapel Hill, well, Durham actually, Durham, yeah. And then Duke University. I'm passionate about giving back to people who are interested in making positive changes in their life. So I've specialized in substance abuse and mental health.
Both of which are significant issues on this island and cut across all economic spectrums, do they not? And
they most definitely, they impact everyone. We all have mental health. It's how you take care of it and how you treat it, and all of us are at risk for addiction. So it is something that impacts every community, but you see it more definedly and up close in a small community such as Nantucket.
What is the range of services that Family and Children's Services provides?
It's a great question. So we've been around since 1962 when the community pulled together and realized they needed affordable, accessible community mental health and substance abuse treatment. So we have outpatient therapy for children, adults, couples, elderly. We also do a really interesting, cool youth program. It's called Children's Behavioral Health Initiative, in which you can have a therapist who works in the school, in the home, and camps for really flexible support for a child at need. We also provide medication management. We are the only provider for psychiatric services for children on island. We actually fly Dominic Maxwell in from the Vineyard to meet that need because we saw it as a community challenge. We also provide an extensive amount of substance abuse treatment, groups and individual, as well as 24-hour, every day of the year crisis response to the community, a telephone line as well as mobile response to a person's home, the hospital, or the police station.
To go back, one of the points you mentioned, medication management.
Yes.
What does that mean?
That means a psychiatrist. We have Dr. Lori Robertson, who sees the adult population, and Dominic Maxwell, who sees children. So this is psychotropic medication to help people improve their lives and manage their symptoms. So it may be children with ADHD and learning disabilities, depression, as well as for adults to handle anxiety and mood management.
How many are on your staff?
We have 17 staff. It's pretty large staff, but many people work in a part-time capacity. We have 7 full-time employees. We're almost all exclusively clinical staff, so we're the therapists kind of in the field doing the work, seeing the clients.
And when did you become executive director?
It's a new position. It's end of January. I stepped up to the role. I'd largely started in a leadership position, reaching out to do trainings with the police station and doing presentations at the hospital, and this opportunity became available, and I was very excited
So it is a new position?
It is a new position for me.
Oh, for you? Okay.
Yes.
But there was one before you?
Yes.
It's now gone.
Yes.
Your board, is that a board of local
Yes,
community?
most definitely. Our board is also largely new, and they've been very active and invested because they personally see the impact it has on the community. It can be such a positive force when we have good mental health and substance abuse treatment. So we have an array of different people coming in for different skill sets: marketing, PR, financial management, fundraising, and they're a great team. I feel fortunate to have the people working alongside of me.
So what's the issue?
The issue. We really kind of pulled our sleeves back and dug in, realizing that we were having a financial challenge, of which it is attributable to many things. We didn't have a lot of grants coming in. Funding had been cut over time.
State, you mean?
State and town funding, yes. And what everywhere nationally is seeing is insurance reimbursement is just gradually going down. So the services that we bill out, we're not getting the money back really from those insurance companies to cover the services. As well as our community has been really rocked by the tragedy of losing youth in our community since 2007, we really started to give without thought and respond to every single loss within the community. As an agency as a whole, to the family, to the teachers, to the police, to the EMTs, anyone we could. And being humanitarians, we didn't really think about fiscally how to keep ourselves afloat.
Well, as they say, a plea of guilty is the first step on the road to rehabilitation.
Most definitely. And that's part of what I'm passionate about now, is really getting our voice out there to share our story. We've been around as one of the longest non-for-profits on island. We are a private non-for-profit, which means the state doesn't actually give us funding. I think that's a misconception people often have. Oh, well, you're state licensed. We're state licensed, which means we go through a vigorous protocol to give the treatment we do, but we're not funded by the state. We are exclusively funded by self-pay, insurance, and fundraising.
So you don't get state grants?
At this time, we do not have any.
Have you had them in the past?
We have in the past, and the state has been instrumental in doing it, but again, we see this as healthcare being...
You have to do that sort of on a contract basis.
We do.
As you do with the town.
Most definitely. Most definitely.
Because of the prohibition in the state constitution against providing municipalities and the state providing direct grants to not-for-profits.
We have a small contract through the Department of Mental Health that supports our crisis branch, and they recognize the service that we're doing, and that's part of me reaching out to the town and the state to say we need additional funding to stay afloat.
How much have you, what's sort of the most you've gotten in any one year from the state?
I think it's currently what we have, which is $156,000.
What's your total budget?
$1.4 million. Annually, so that's a large deficit.
And well, yeah, but some of that's covered by insurance too. I mean, what percentage of that? How much of the $1.4 million do you have to raise?
We are at an operational budget gap of $660,000. Of which that would give us a year to turn things around, and we've already started aggressively seeking the funds and put those in for grants, really internally tightening things up financially to make sure we're tracking every insurance claim as we can, developing employee assistance programs, EAPs, with local entities to support the free service that we're already giving to the really hardworking community of Nantucket, and then really having benefactors. I haven't met one summer resident that comes here year after year and says when they leave on the boat in August that a part of their heart stays here. To make that the community that they want to come back to year after year, we ask that they give so that we can be part of that healthy community.
I mean, the need keeps growing.
It does.
And the sort of contractual funding, whether it be state or from reimbursements, keeps getting squeezed.
Yes.
The town has not.
The town, you know, I would say that I've been very encouraged by everybody's response. It's kind of like the canary in the coal mine. Not many people realized we were struggling the way that we were. Many non-for-profits feel that way. It's just come to a head recently in which we recognize that we need support, and the town has been receptive, and we're working and having communications in some of those tough talks. The hospital is on board, and we're collaborating together. Other non-for-profits are aware.
So what are the thrusts which you've taken on, which you think will be the most effective in helping you through this?
Yes, most definitely. I would say that our increased support from the community is our second shop. We've moved it to the heart of the island, which is literally what we feel we're part of the community generously donating items there, and 100% of the proceeds go to supporting family and children's services.
How much does that provide?
You know, we've just moved it to the new location and accepting credit cards, and it's all computerized now. We feel like it is going to be a sizable part of keeping us afloat. We've already put in a lot of the grants. We hope to hear back closer to September and fall that would be sustainable, and we're doing the good work in which we're entitled for, as well as increasing fundraising. We realize that that needs to be an emphasis we do. So while we tighten things internally and we make sure that people are paying their co-pays and providing that sliding fee service, that we have the money to cover it so we can continue and expand services.
Back to the town for a moment. Obviously the town does their funding of organizations such as Family and Children's Services through the contract review process and
Yes.
the action at town meeting. Have you been given any encouragement that there's anything possibly available to you before next year's town meeting?
You know, I think that that's still underway. I can say that every day the situation is still evolving. I have been communicating with the town about our concerns and how they may help us, and we are hopeful that the community and the town itself will be part of that change.
So what is the message that you'd like to leave with the people who are watching?
That community mental health and substance abuse treatment is here, and it's a vital part of the community, and to be a tight-knit, healthy community is being part of it by supporting, and that's talking about it, recognizing it, fundraising for it, and donating when possible.
The other side of the coin is the organization obviously has
Yes.
an obligation to,
Yes.
to pull itself together. What is it doing to do that specifically?
We have had a new surge as far as our executive board. They've been hands-on. We're still recruiting and having people that are ready to be able to support us and brainstorm and more oversight. I can say that I am developing policies internally to really track the money, provide a sustainable plan to become us fiscally solvent, and retaining staff. Our staff is amazing, the services they do is amazing, and we need to expand. Because as you said, our community continues to grow, as does mental health and substance abuse treatment. So I can say that we're developing a completely new plan as far as using computers and electronic medical records and reviewing our contracts with insurance companies to really get as much as we can and collaborating with the community as a whole. I think our partnerships with the hospital, the police station, the school, these are all things that I've been very encouraged by everyone wanting to step up and say this is a community effort.
Tess Pearson, thank you. I think you should come back in a couple of months and let us know how you're doing.
I would like that. I would like
I think
to.
it's important to keep people informed, and
Yes.
hopefully between now and then you'll have made some progress and keep doing the very important work that Family and Children's Services is doing.
Thank you for this opportunity.
Nice
Thanks.
to talk to you.
Likewise.